So what is evidence-based medicine? Now, evidence-based medicine, for the most part, is a good thing. It says, well, what is the evidence for the treatment decisions that you're making? The problems in psychiatric research, however, do not make randomized controlled trials easy. Our patients experience highly comorbid illness. And in order to study the effectiveness of various interventions, you need to refine a sample such that you exclude people who have coexisting conditions. However, in clinical practice, coexisting conditions is the norm. So, insurance companies and other people who are deciding on what is and is not appropriate care are looking at data that may or may not be generalizable to a clinical population that is more commonly seen, especially among adolescents who have been understudied, who have complicated mental illness, which is highly, highly protean, shifting, hard to categorize. So the quote-unquote evidence for a treatment for a given illness or a given patient is very limited. A good insurance company, quote-unquote, recognizes when they're being penny wise and pound foolish and may invest in preventive care and may take care of patients who are having an acute on chronic exacerbation and may not squeeze the life out of the doctor and the patient. On the other hand, other insurance companies where there's less acumen or less psychiatric sophistication may care more about profit margin and thus may, irrespective of the nuance and the ambiguity, squeeze patients and psychiatrists such that we are making decisions that are suboptimal, that are pressureful, and that open the door for catastrophic outcomes.